I needed a career where I was interacting more with people, and that sort of steered me kind of midway through my college career when I was headed for graduate work in chemistry towards medicine. I was a little leery. I actually have always been a little grossed out by medical things growing up. And I had the opposite experience. The first surgery I did for me was like a thing of sheer amazement, wonder, and awe. I remember it was a cancer surgery, and I didn't know anything really. I was a green medical student, and I stepped into that OR, and they opened this patient up, and to see the body working in concert, I could see the pulse of the blood through the blood vessels. I could see the beat of the heart up against the diaphragm, and you could see this tumor, which was black and ugly shaped and looked like it didn't belong. And to witness that, instead of feeling overwhelmed with nausea, I was just almost overcome with awe about how the body could work and how I might play a role in helping to restore order. Well, many times the first visit, the patient is full of anxiety. They have either just recently been told they have cancer, or they've been told there's a concern that they might have cancer. I never worry about their blood pressure because blood pressure is always high in my clinic. And they come in with a lot of questions and a lot of uncertainty. And once the patient hears all these options, they're usually overwhelmed. They usually say, hey, well, what would you do? Or what would you have your dad do? And I can coach them through that, because actually my dad had prostate cancer. And so I can talk about my dad's story, which was very influential for me in the way I care for patients. It helped me to see what it feels like dealing with cancer and facing cancer. And I think it's made me a better doctor to try to understand the patient point of view, because in the end, we'll all end up being patients at some point.